Well, hello, it's me, Sophia, and I am doing my very first Springfield City Group communique. And I thought I would do this a little bit different by delivering you a digital message today. We'll go through a check in, talk about all things COVID, working from home, and I will hopefully leave you with some daily inspiration or motivation. I would really like to thank Haley. Thank you for the nomination and the fantastic email from yesterday. It has been so long since Springfield Ideas Unleashed, but what a perfect way to start the year. Thinking about innovation because all of us are affected by disruption. All of us need to innovate and we need to do things differently, particularly right now as we live through a recession, but first and foremost, a global public health pandemic. So I've certainly gained an hour, and I encourage you all to, as Bob said, use your commute time to do some exercise. Fantastic advice. It's really been fascinating because actually I studied public health and health services as an undergraduate degree at QUT. And it's really interesting to see how epidemiology and the importance of general public health itself has come to the forefront. I think as Australians, we are so fortunate to have a strong public health system, a strong healthcare system that really we should be very proud of. And government interventions and initiatives often are so quickly implemented, despite the fact that there are added complications, a federated system and states. But as you can see, everyone is working together in the National Cabinet, and it is really fascinating to see the science and the art of preventing disease, prolonging our life, improving the quality of our life in an organised way. And this makes me think of Springfield because actually when I studied about public health, one of the main things we talk about is health promotion and health prevention. So that's all about wellness. And really, Springfield is an exemplar of how to implement and plan for good public health and have that health promotion and preventative measures within the city itself. And that's all about walkability, incidental exercise, having health services close by and planning for that, boardwalks, cycleways, green space, and this green, clean environment that, we are so fortunate to have is something that really does help us prevent disease and promote health. And something we should really be proud of. I was listening to Mater Hospital's infectious disease expert, Dr. Paul Griffin. He was answering some questions on COVID-19 on ABC Brisbane this week, and he's been in and around the place, fact-checking some things around COVID-19. So there is no such thing as herd immunity. It's surprising that people think that, but luckily we live in 2020 and we all know and all the experts know that doesn't exist. But our general immunity is important. So keep exercising, keep having good sleep, and from a mental health perspective, talk to people, talk to your colleagues, talk to your friends and family. I just think it's really heartwarming to see as a community we're staying in our communities and we're coming together. I think across the world right now at 8 o'clock, we're clapping our healthcare workers and our first responders because these essential services and healthcare professionals in particular are doing amazing things. I think pandemics are here to stay. In fact, viruses are here to stay, and they've been around for a long time, and they're part of our human existence. We've had 6 pandemics in the last 20 years, from SARS to MERS, Zika virus, Ebola, H1N1 influenza, and now COVID-19. All the factors that brought these sorts of pandemics and epidemics into existence are there now. So an increased urban population, really quick, easy, accessible airline travel, and an increased amount of food animals, because most of these, if not all of these viruses, come from animals at first. And these environmental changes and natural disasters. So use this opportunity as a bit of a wake-up call. There will be more disruptions, and we will need to learn how to do things differently, how to be more adaptable. Don't quit, don't give up, you've got this, and we're in it together. And I think we can see that when you are in it together and you do have a coordinated response, you can get back to normal faster and quicker. So I guess there's a couple of things I'd like to add. Have access still to your Trello account, which we use during Springfield Ideas Unleashed. You can create a Kanban board. So one of those boards are with, several columns, and usually you start with a backlog and you list your tasks under that column. The next column is your to-do column. I found it very useful to keep track of things, and while I'm working from home, having that organized, systematic approach is super important, and I found really interesting. As a general observation, I think we need to use this time, and it requires us to do things differently. We need to do that creatively, and I think we are. And, we won't see things sometimes immediately right now, but you still need to do things that create value, because once the market and the economy and the restrictions are lifted, things will bounce back. And that's when the effort that we've done now during quarantine will be realised. So I've rambled on a little bit. I hope that some of you have listened to this and enjoyed something a little bit different. I think variety is the slice of life sometimes. My nomination is Karina. Don't worry, I will be putting that in the email itself in case people don't get to the end here. Have a fantastic day, and I'll see you on Microsoft Teams. Keep washing your hands. Bye.